Are you struggling with hair pulling disorder? Let's talk about this condition, why it happens, and how to treat it. Hey everyone, my name is Dr. S, psychiatrist and lifestyle medicine physician. Hair pulling disorder is also known as trichotillomania. This mental disorder is part of a group of conditions known as body-focused repetitive behaviors. In the Diagnostic and Statistical Manual of Mental Disorders, it is listed under Obsessive-Compulsive and related disorders. Trichotillomania involves frequent, repeated, and irresistible urges to pull out your hair. All body areas may be affected, but most commonly the scalp. The eyebrows, eyelashes, and the beard are also common. Pulling out hair from your scalp often leaves patchy, bald spots. This can be frustrating and distressing. It can also affect your work, school, and social life. You may experience increasing tension before pulling out your hair or when you try to resist pulling. There is often a sense of pleasure or relief after the hair is pulled out. You may find yourself pulling out specific types of hair. You may also take the same steps in the same way each time your hair is pulled out or pulling out hair in specific patterns. Some people enjoy playing with pulled out hair. They may rub it across their lips or face or roll it in their hands. This hair pulling occurs despite repeated attempts to decrease or stop. Trichotillomania is driven by escalating tension, which makes you pull your hair to get relief from this feeling. The reason for this is that hair pulling disorder is a compulsive behavior. You don't pull your hair because you want to. As much as you would like to discontinue the hair pulling, you can't stop. Many people derive pleasure, gratification, or relief when pulling out their hair. Hair loss caused by this condition is usually visible to others, but not always. You may take extra steps to hide the hair loss because you feel ashamed or embarrassed. People who experience trichotillomania may also have nail biting, lip chewing, or skin picking. Skin picking is also known as excoriation disorder, and I'll talk about this in a later video. Some people may also pull hairs from pets, clothing, or toys. There are two categories of trichotillomania. The first type occurs in childhood and is more common. It is also less severe and occurs approximately equally in girls and boys. The second type of trichotillomania usually begins in early adolescence. It is more serious, tends to last longer, and occurs in about 1 to 3% of the population. This number may be higher considering that there is shame and secretiveness with this condition. Females are about 9 times more likely to have this second type of trichotillomania. A study also shows that someone with chronic trichotillomania is likely to be the only or oldest child in the family. About 35 to 40% of people with trichotillomania chew or swallow the hair they pull out at one time or another. This condition is known as trichophagy. The swallowed hair can cause a medical condition known as trichobezosis. These are hair balls accumulating in the stomach which can cause obstruction. Some people who have hair pulling disorder can also present with OCD, anxiety, depression, eating disorders, and personality disorders, or other disorders that may be present. So what causes trichotillomania? There is no known singular cause. Genetics likely plays a role, which means it may be inherited. A study showed that hair pulling is linked to stressful situations in more than 25% of all cases. Disturbances in mother-child relationships, fear of being left alone, and recent object loss may contribute to this condition. Depression and drug use are some other factors that may predispose people to trichotillomania. What is the treatment for hair pulling? Your treatment depends on how severe it is. Mild cases of trichotillomania may not require any treatment. You may find ways to avoid the triggers or distract yourself, and it could resolve on its own. More severe or prolonged cases may require treatment with therapy and medications. The primary treatment for trichotillomania is a type of behavioral therapy called habit reversal training. With this therapy, you learn how to recognize situations where you're likely to pull out your hair and how to replace them with other behaviors. One form of habit reversal training is called decoupling. It involves quickly redirecting your hand from your head to another part of your body whenever you feel the urge to pull out your hair. Acceptance and commitment therapy is another type of therapy that can help you learn to accept your hair pulling urges without acting on them. There are no standard medications for treating hair pulling disorder. Some studies have shown that medications like naltrexone and acetylcysteine and olanzapine may be helpful. If you also have other mental disorders like depression and anxiety, treating these conditions with antidepressants and anti-anxiety medications can be beneficial. Dealing with trichotillomania can be challenging. Meeting others with similar experiences who can relate to you and offer support is helpful. So consider joining a trichotillomania support group. An example of such a group is the TLC Foundation for Body-Focused Repetitive Behaviors. This group offers education, support, and treatment options for trichotillomania. Let's share this video with others. Thanks for listening.